Welcome to the Med Madness podcast. Today we will discuss a sensitive but crucial topic in obstetrics, intrauterine fetal demise, or IUFD. Intrauterine fetal demise, often referred to as stillbirth, is defined as the absence of fetal cardiac activity at or beyond 20 weeks of gestation. It's a devastating event for any family and a challenging situation for healthcare providers. Understanding the risk factors, evaluation, management, and potential recurrence is essential in providing the best care and support to these patients. 2. Next, consider the case of a patient at 34 weeks gestation with IUFD. The evaluation should include fetal studies like autopsy and karyotyping, and maternal testing guided by patient history. For instance, if there's a history of multiple prior spontaneous abortions, antiphospholipid syndrome should be suspected, as it increases the risk for vascular thrombosis during pregnancy. Thrombosis in the uteroplacental arteries can lead to decreased placental perfusion, resulting in fetal growth restriction and eventually stillbirth. Identifying such causes helps in determining recurrence risk and preventive strategies for future pregnancies. Patients with a previous stillbirth are 2 to 10 times more likely to experience another. However, the exact risk for recurrence and appropriate prevention strategies depend on the underlying cause of the first stillbirth. Therefore, a thorough evaluation, including fetal autopsy, genetic testing, placental examination, and maternal testing, is crucial. Finally, let's address some misconceptions. For example, kit counting has not been shown to prevent stillbirth recurrence, and recommending more frequent prenatal visits without understanding the cause of the stillbirth may be inappropriate. Also, while initiating low-dose aspirin during the second trimester can decrease the risk for preeclampsia in patients with risk factors, further evaluation of the stillbirth should be performed before making recommendations for the next pregnancy. In conclusion, intrauterine fetal demise is a complex and emotionally charged condition. Comprehensive evaluation, empathetic communication, and appropriate management are essential in providing the best care for affected families. By understanding the risk factors, causes, and management strategies, we can help reduce the incidence of IUFD and support families through this difficult experience. Thank you for joining us on this episode of the Med Madness podcast. Stay tuned for more discussions on important medical topics.